UNITY VCS is indicated for use during anterior segment and posterior segment ophthalmic surgery. Federal law restricts these devices to sale by or on the order of a physician. Appropriate use of system parameters and accessories is important, as improper use may result in patient injury. Please refer to the directions for use for complete indications, warnings, and safety information. For full important product information, please visit unityvcs.com. References and disclaimers related to topics discussed in this podcast can be found in the description.
Welcome to RetinaLIVE. I'm Christina Weng from Houston, Texas, and I'm delighted to serve as the host of this podcast, which is entitled Transforming 27-Gauge Surgery. Honored to be joined today by my amazing colleagues and friends, Dr. Mrinali Gupta from Retina Associates of Orange County and Dr. Omesh Gupta from Mid-Atlantic Retina Wills Eye Hospital. Welcome to you both.
Thanks for having us.
Absolutely. So it's really exciting. The Unity platform, as you know, launched earlier this year in the spring, and all of us have been involved in one way or another with its development. So I'm sure we could speak all day on all of the amazing benefits and innovations that this new system offers. And this, just to highlight a few, includes the world's fastest vitrectomy probe at 30,000 cuts per minute, state-of-the-art phaco capabilities in the VCS system, and of course the intelligent fluidic system optimizing stability and efficiency. But our focus today is going to be on the advancement in 27-gauge instrumentation, which is part of the portfolio. So let's go ahead and dive right in. You know, it's interesting if you look back at the history of retina, 27-gauge surgery has actually been around now for over a decade. It's been along for many decades, I believe. And yet, it's probably been adopted by a smaller proportion of surgeons than what you might think, given that we are microsurgeons, right? We do microsurgery, and it seems like smaller gauge would be more beneficial. But I think some of the challenges, which we'll get to, are now being addressed by the advancements in this new portfolio of instrumentation. And one of those really important ones is the dynamic stiffeners, which are on the light pipe as well as the cutter, because one of the big complaints, as you probably both know and experienced, has been bending of the instruments. Start with you, Mrinali. Can you talk about 27-gauge? How much were you using it before? What was your experience like with the older generations of instrumentation? And now speak to the experience with the new dynamic stiffeners on the 27+ gauge system.
Thank you. I agree. Really excited about the advances in this area. I'd say historically, I reserved 27-gauge surgery for certain macular cases and hybrid cases, 27, 25 for diabetic tractional retinal detachments. And largely because of the issues with instrument flexibility and lack of stiffness, and also because the efficiency of the vitrectomy itself was less, slower surgery, getting all the vitreous out. And I've had the good fortune of being able to use the new Unity system, both in the wet lab at the research center down in Lake Forest and as well as in the OR in patients. And the 27-gauge now to me feels just like 25-gauge, not just the dynamic stiffeners and the instruments that prevent bending and issues related to that, but also just the fluidics and efficiency of the vitrectomy itself.
Yeah. How about you, Omesh?
Yeah, I really liked the 27-gauge cutter a lot, and same with Mrinali. I used it a lot for diabetics. I'd have a larger gauge system, and then I'd pull the cutter out, and that's how my baby step into 27-gauge started. I love the manipulation of tissue that you get with it, the control. But now one of the issues that I had with the older systems is when you're out in the periphery and you're torquing, you get some bending of instruments, whether the light source or the cutter. And with the newer systems, the dynamic stability, it really improves your ability to control the eye. So I think it's definitely going to convert some people over to 27 that previously were using larger gauges.
Can you guys talk about maybe what proportion of your patients were on 27-gauge prior to the introduction of the new Unity associated portfolio of instrumentation? And then maybe also chime in, you alluded to this already, Omesh, but do you think it'll propel people to make that switch over?
For me, probably 5-10% max were using 27-gauge cases. I'd like to think that I will switch over a majority of my cases to 27 gauge with the new instrumentation.
Yeah, I'm certainly going to try. I think the combination of the new machine as well as the new stiffening capability of the 27 gauge instrumentation, I think it's compelling for me. I mean, I used much larger instrumentation before, and I would use 27 gauge for, much more straightforward cases, fluorectomies or a membrane peel, macular hole cases. But I think now the ability of the machine to function and almost appear, as Mrinali said, like a 25 gauge platform under the Constellation would be probably more appropriate for 27 gauge with the Unity.
Yeah. I really like it for macular cases, but I also work half my time in a county hospital where we do a lot of really, really advanced diabetic TRDs. And so it was always a sort of a difficult choice for me because I wanted the 27 gauge instrumentation for the dissection of membranes. And I love, people like Maria Baracol, who we all know and are friends with, do such elegant work with that instrumentation. You could sneak into those small spaces and crevices and really work your way through those membranes. But at the same time, you do need to remove vitreous from the far periphery. And I would always find it frustrating if the instruments did bend, or I also work with fellows who are even less elegant in sort of the torquing of the eye.
Totally.
And then when those instruments bend, not only is it an additional cost, but it's time to switch out the instruments too, right? And so I think that would preclude me from necessarily going to 27 gauge more often. But I agree with you both. I think with the dynamic stiffeners in place, I really feel like you can get a great torque on the eye. It feels very much like 25 gauge in terms of efficiency as well as the pliability of the instruments. And I do think it'll, at least for me personally, start pushing me towards that way.
There's two things I really am motivated now to be more comfortable with transition. One is the fact that you can do oil in and oil outs with a 27 gauge platform, where previously I couldn't. I'd have to convert to a 25 if I'm going to taking the oil out. And oil in, we've played around with the VFC, and it's amazing like how quickly 1,000 centisoc or even 5,000 centisoc through a 27 gauge VFC cannula infuses in the eye. So to me, that was a barrier, but now it's less of a barrier.
I'm really glad you brought that up. I was very impressed. I haven't used it in terms of oil in and out yet in a real patient, but I used it several times in the wet lab, and I was very impressed by how expeditious that was, because you're right. For oil cases, I actually leaned sometimes towards 23 before, and now I think, with how quick the system works, 27 gauge is really a valid option.
Yeah, I think, I think many of us have had a tendency over time to explore different gauges and then switch to primarily one type. I use almost exclusively 25 gauge. I almost never use 23. Sometimes I use 27. And I think I will be shifting towards 27 in that way. Just with all the instruments that are now available, the stiffeners, and even the forceps are better now on the 27 gauge platform.
Go ahead.
I'm sorry. The other thing I'm much more intrigued using now, and I do a fair bit of these lens cases. So for secondary IOLs, they've had recent cataract surgery, they have a phaco wound, they have a paracentesis wound. They're getting 5-6 wounds in their sclera whether they do a sclera fixated with Cortex or the Umani. These eyes tend to be a little bit on the hypotenuse side post-op, so I think moving to a smaller gauge instrument is going to be attractive.
Yeah, I think there's so many benefits, and probably some that we haven't fully realized yet, because it has been the minority of gauge platforms that most of us use, but we're going to learn more and be able to refine that more as we transition. I love that Mrinali brought up the membrane peeling and the forceps there, because it's a great segue into the next topic I wanted to discuss. Omesh, let's focus first on the engineering of the shark skin forceps, which were designed to optimize the force that was needed to grab delicate tissues like the internal limiting membrane, only a few microns thick. What advantages do you see with the shark skin technology, and what types of cases are you using these types of forceps for?
Well, I mean, I'll start with the last question. I use it. I don't see a reason not to use it. I use it a lot for pretty much everything. The platform of the shark skin has a structured tip. There's like these microablations on it, which are really nice. Grabs the tissue much more forcefully with very little downward pressure. So whether it be myself or even fellows that we teach, there's less downward pressure compared to like the standard sort of GRIESHABER forceps, which has a unstructured tip. It's a smooth surface. The platform is also wider with the shark skin, which I don't know if anyone appreciates, but you can certainly tell when you're grabbing it, manipulating tissue. It's definitely very, very noticeable. We did a study where we looked at like shark skin versus the GRIESHABER. And regardless if you were a beginning surgeon or like a seasoned fellow or even an attending, and the attendings were probably the most skeptical about the benefits of shark skin, whether you looked at them in a masked fashion, they did better with shark skin than they did with GRIESHABER. So it was quite impressive, the difference.
Mrinali, one of my favorite recent design innovations was the reflex handle. And it's just super sleek. I bet we have similar glove sizes.
That's
But
right.
for me, it feels so comfortable in the hand. And that's critical when we're doing micro maneuvers in, vitreoretinal surgery. But, even my colleagues with larger hands and larger glove sizes, we've had several male fellows that we've trained over the past few years. They actually really love that reflex handle too. The basket is smaller, so it's a little bit less likely to hit against the indirect viewing system, which gives you just a larger range of motion. What has your experience been with that?
I love it. I love the 27 gauge reflex forceps. In the 27 gauge, it's stiffer than the old 27 gauge Revolution forceps. The platform's a little wider, so it's really effective at grasping and maneuvering the membranes. But as you noted, it's a shorter forcep and a thinner forcep with a smaller basket, so it just takes up less space in that tight microsurgical space that we're working in. And the movements are smaller. It requires less force to close the forcep and less rotation to turn the forcep.
Absolutely. Omesh, do you have any experience with the reflex handle?
Yeah, I actually like it too. I mean, I wear like a 7.5 glove, which I think is like, I would say average size hand. And even then, I really like it a lot. I'll tell you straight up, I didn't think I'd like it as much as I did. I was very sort of tied to the standard basket size handle, and I really like it a lot for that reason. The other reason I use it and find it very favorable is like when you're pulling out subretinal bands. Like sometimes I'm pulling out a subretinal band, and I tend to spiral it as I'm trying to pull it out. And with that basket, I would often have to like spiral on my hand and almost be a little bit sort of uncoordinated, try to see if I can keep on continuing to pull it out. With that smaller basket, I can twirl that thing so much more easier, and pull out larger subretinal bands much easier.
Yeah, totally agree with you completely. So, and then the flex loop, I want to chat a little bit about that. This was originally designed to initiate membrane peels, but the field has gotten so creative in terms of its uses. Do either of you use the flex loop routinely in your surgeries? And if so, what types of cases are you using it for?
I don't use it routinely. I do it in when training fellows that they sort of want a baby step towards starting to peel ILMs. I will start them to I initially will initiate the flap for them, and then they'll take over and try to peel. If they want to start with the flex loop, I think it's a really nice way to start it, and then they'll switch to like either a shark skin and peel the rest of it.
That's a really good takeaway. Well, let's move on to briefly visit some of the other aspects of the Unity 27 gauge portfolio. One of the common gripes with the 27 gauge backflush was that the soft tip was that it was challenging to insert through the cannula due to kinking. And I think this is the bane of everyone's existence when we're doing retinal detachment repairs and the like. Mrinali, have you tried the Finesse Modify Backflush Adjustable Soft Tip? And what were your impressions of it? I mean, I like the color tip because I think it makes it a lot more visible. Yeah. But I also love the option for passive and active aspiration. What are your thoughts and what's your experience been like?
Yeah, I agree. I think we've all suffered through that soft tip that's not entering into the valve nicely. It's not a very classy look.
No,
in
not
the
at
operating
all.
room. But I do think that the valve entry system in general is better with the new Unity systems. I've only used the backflush cannula in cases where I'm doing a direct PFO to oil exchange. And for that, I find it to be fantastic. I love, having total control of passive extrusion in that way.
Fantastic.
Yeah,
How about you?
It's nice to comfort in the fact that you guys are having trouble with this too. I thought it was my presbyopia kicking in or something.
Definitely not. Or maybe it is.
Yeah, I think with the Unity platform, the valve improvement has really helped a lot with putting that soft tip in the eye. I like that backflush, and I've used it a couple times in the scenario of subretinal PFO, actually. Even if I'm doing a larger gauge surgery, I'll pull out the 27 gauge backflush Usually what I'll do is I'll, go in with BSS subretinal and inflate up, and then create like a little retinotomy with that 27 gauge backflush. And I passively will remove it, because often when I active, I'll sometimes engage some retinal tissue around where the retinotomy site is. So when I passive, it will just sort of allow that PFO to come out of that space really nicely.
Yeah, no, that's a fantastic tip. Thank you. Omesh, what about the 27 gauge chandelier? Have you tried that yet? And what's the illumination been like compared to other types of chandeliers that you've used or typical light pipe illumination?
I like the illumination a lot. The illumination of the light source as well as the chandelier is really nice. I've done it with bimanual cases where I've used a chandelier. I've done it once with like a buccal case where we're draining intraocularly. The illumination's really nice. It's a lot brighter, and I almost kind of because before I had to direct the chandelier to the posterior pole when I'm doing bimanual. This one it's way more forgiving.
Yeah, fantastic. How about you, Mrinali? Have you had a chance to try it out?
I have. I primarily have used the 27 gauge chandelier in diabetic cases that require bimanual surgery, and I agree with Omesh. I think the visualization is excellent for work like that.
Fantastic. Can we talk also briefly, you mentioned you love the valve system in general, but what about the entry and the infusion systems? Have you noticed any improvements as you're using the new set of instrumentation on your patients? Do you feel like there's any learning curves with the 27 gauge system that might be important to share with other surgeons?
I think I would encourage surgeons to give it a try. I think there definitely was a stigma towards 27 gauge surgery, especially with the instrumentation being a little bit more flexible. And I think it's worth trying. I would try it on, a much more straightforward case first and ramp your way up depending on your level of comfort. Getting to your infusion thing, and most of the people that work with me and I teach will laugh at me when I say this because I'm so neurotic with this, is the service loop on the infusion is, for me, such a huge thing.
Yes.
Going back to the Accurus day, you really had to be careful with it. Constellation, you could be a little bit more, they had a little bit more forgiving, but it's still, you had to be, especially in oil out cases, I tend to make sure that the infusion is directly perpendicular, especially when you're going back from oil to air. But the new Unity, I love it. That thing that sticks to the cheekbone.
Yes.
It's awesome.
I think that's really nice. And it just shows you these very tiny things, as we continue to raise standards and bars in our field, just these tiny little modifications really make a big difference. I'm just as neurotic as you about that and probably other things too. So anything else to add?
Yeah. No, I really, it's a really, seems like a small thing, but especially in cases where you're moving your infusion, like some of the IOL cases where you're using less entry points and you're trying to get that sticker off, and it's like so frustrating.
It's so frustrating.
This new little attachment is just saves some time there.
Absolutely.
Yeah.
All right. Well, anything else to add, Omesh?
No, I'm good.
Okay, perfect. Well, it was so fun to discuss the new Unity 27 gauge system with two vitreoretinal surgeons that I respect and admire so much. I think this newly launched platform from Alcon offers so many innovations that are going to continue to elevate the quality of the surgeries that we do. Any parting thoughts as we depart? I'll start with you, Omesh.
Yeah, like I said, I would reiterate, I think it's going to be interesting to see the quantum leap of the Accurus to the Constellation and now the Constellation to the Unity. My initial impression is that the amount of improvement that they've made on this machine is just as much as from the Accurus to the Constellation in so many different ways, not just on the cutters themselves and the 30,000 cut rate. The lighting is like a whole nother level, changing the lighting when you're doing a vitreous hemorrhage case versus island peel. I think that's a whole new area that I'm going to explore a lot.
Fantastic. How about you, Mrinali?
Yeah, I echo what Omesh said. I'm really excited. I think there are so many little and large pressure points in our surgeries that have really been addressed, from things like having a frag, the entry system, fluidics, 27 gauge stiffness. I think it's going to be a really good thing. And we didn't talk about it, but just from the fluidics of operating with high cut rates and efficiency while maintaining stability of the ocular pressure and the mobile retina. I'm just really excited about all these advances, and it's the first big improvement in my entire retina career. So I'm really looking forward to adopting some of these innovations.
You're just bragging about how young you
Yes,
are, Mrinali. Well, I couldn't agree with you both more. I think all of these advancements are really going to help us, and we're going to learn how to maneuver little tricks as we continue to get more familiar with the platform. So it was great to chat with you again today, and I want to thank Alcon for this opportunity to be in this glass booth with two respected surgeons. Wishing everyone a great rest of your meeting in Long Beach, and be sure to catch the rest of these episodes for RetinaLIVE. We're recording several of these during ASRS, and I think they're all going to be great conversations. Thanks, Omesh. Thanks, Mrinali. Great to see you both always.
Yeah,
Thank
you
you.
too.
UNITY VCS is indicated for use during anterior segment and posterior segment ophthalmic surgery. Federal law restricts these devices to sale by or on the order of a physician. Appropriate use of system parameters and accessories is important, as improper use may result in patient injury. Please refer to the directions for use for complete indications, warnings, and safety information. For full important product information, please visit unityvcs.com. References and disclaimers related to topics discussed in this podcast can be found in the description.